Good afternoon and welcome to the Senate Committee on Government Operations briefing on information technology projects in the executive branch. Today is Tuesday, March 9th. It's 3 p.m. We are in room 16 with members of the committee joining us and the public. I'm Sharon Moriwaki, chair of the committee, and joining me today would be members of the committee, the Chief Information Officer, Douglas Murdoch, and we were reconvening from last session on last Thursday, and we are continuing with the Department of Human Services today. So I will move right into welcoming again Mark Choi from the Department of Human Services to tell us about their upgrade projects and where they are and some of the opportunities and challenges. Mark?
Great. Thank you, Chair and other committee members. Again, Mark Choi here, Department of Human Services, Enterprise Officer. So as I said last week, we have 3 major IT modernization projects that combined serve over 400,000 of our most vulnerable communities in Hawaii. Excuse me. I also mentioned that DHS had many smaller IT modernization projects that kind of support our efforts to change the way that we do business and deliver our services. We've been able to leverage federal funding matches based on our current partners, as well as COVID monies that were given to us as part of the CARES Act. And that really served as a foundational catalyst for us to really see investments at a DHS level so that we could react quickly and rapidly and respond to the needs of the community when it came up as we needed it to, right? And so we've been able to keep and deliver our programs and our benefits, and we've been able to keep those dollars flowing into the individuals and families in Hawaii that needed it over the course of the pandemic. So our existing IT modernization projects, like I said, our COVID projects, they helped us effectively respond to that pandemic. And I know that our clients appreciate it, and I know that our employees appreciate it as well. So we expect and hope for your continued support to build on these successes and leverage the technical foundations that we've been able to put in place so that we can change the way the government operates, right? And so the last piece that I kind of want to get into, as we're talking about using IT as part of our strategy, right? And how we've been able to adopt the newer technology sooner and in smaller chunks, and then build upon it by reinvesting and enhancing it over time. That's kind of, some of the things that we're trying to do from an operations perspective on how we leverage technology, right? We look at technology as a means to build capabilities that we can scale across our department and hopefully at some point statewide, right? But there's one kind of more thing that we need to sort of address, and it's kind of the elephant in the room, right? And it might be one of the most important pieces of the puzzle, right? And that's our people, the IT workforce. Because technology doesn't install, configure, or run by itself, right? And we know that. It takes a workforce to actually do things with technology. It's not like you can buy a flashlight and it just works or doesn't work. These things are complex in nature, but we have to strive to making it simplified. So again, we have to mix, and I think Doug had mentioned it in the past, it's people, process, technology. And so we have to look at that from that perspective, and also we have to mix in the technology and our investments in those people who have to work with those systems. And so we have to mix it in with the people and the processes that are already in place. Right? We have to look for the gaps, and we either have to skill up or acquire new resources needed to fill those gaps. At DHS, what we try to do is we try to provide opportunities through our projects, big and small projects, to gain those experiences that are needed to actually operate and sustain those new technologies that we're putting in place. Right? We also look to try to provide additional support through training. And that's always something that we look for when we're actually putting in a new project or a new technology. It's ensuring that we get the right mix of technology components, hardware or software, and the right set of service components, whether it's consultants that will help us initially configure, or it's additional training and opportunities for our people to actually start to do and build things, leveraging that same technology for smaller projects. And so I always kind of keep those two things in terms of what we need to do from a workforce perspective. I think the other issue that in general state has with the IT workforce is like everyone else, not unique to Hawaii. The IT workforce is aging, and we're always at risk of attrition, right? And that could be through retirements, job transfers, exit to the private sector for jobs with better pay, or the general vacancies that we have because we have challenges in recruiting, right? So, for DHS, I would say over 70% of our IT workforce can retire over the next 3 to 5 years. And currently, because of COVID and the budget deficits, another 25% of my IT positions are frozen, defunded, or on the chopping block, right? So how can I build the IT capacity that we need to support the legacy environments, the existing infrastructure and applications, our current technology set, and our future technology, if I can't build the workforce needed to actually man it, right? So that is the last piece of this puzzle that we need to address. And hopefully we get the support. I look at it in the sense of we can continue to spend tens of millions of dollars across the state for high-priced out-of-state consultants every year, year after year, or we can start to plant the seeds of building an IT workforce within state government, right? And that would be a smaller investment, but it would have to be over time and continuous, right? And so we're not going to get day one benefits right out the gate. But for us, once we can start to establish that, hey, this is an important priority, and we'll continue to support it, then over time, we'll be able to build that pipeline, whether it's coming out of the UH system or our high schools and into the workforce at the private sector level through internships and then being assigned to state projects, or coming straight into state government and then providing them an exit strategy into private sector. But building that ecosystem for the IT workforce that Hawaii government is going to be a fundamental piece for. So that's kind of what I'm looking for. I got, like I said, 25% of my workforce positions currently empty and frozen, right? That's 16 positions out of my shop. For me, that's an investment of state funds about $1 million. But what would that allow me to build, right? That would allow me to man a team similar to Doug's in terms of how do we manage our portfolio of projects? How do we keep governance? How do we do our project management, contract management? But it also gives me technical positions so that I can actually have my people sitting on those projects, learning as we're developing these new systems. And that's part of the knowledge transfer that needs to occur that we need to also focus on. So I'll just close on these 4 points, right? And it's basically, we need your continued support to transform the way that we do business through our IT modernization projects, through continuation of CARES Act investments. We need to look for creative and opportunistic ways to either partner with private sector or our federal partners to keep the money flowing in so that we can keep these projects and these kind of technological advancements moving forward. We need to ensure that we're going to brace for the next wave because COVID isn't over, but what happens when there's something else, right? It may not be COVID next time. It might be some other sort of disaster of some sort or some sort of other issue, right? And then last, we need to actually focus on our people. So I'll close with that and I'll take any questions.
Thank you. I don't know if there any other members are joining us remotely or they have questions. If not, I do. You mentioned that you have funds that Senator Vale, you have any questions of Mark Choi from DHS? Unmute. Okay. Do you have any questions, Senator Favela?
Well, I don't. I just listening.
Okay, thanks for joining us. So I do. You said that you have funding and positions are frozen. What are the positions that you think are critical you say you want to mirror what ETS does in terms of having a really strong core team so that you can continue to transform? What are those positions that are critical for a department like yours to have
Yeah.
the capability? What are those positions? What kinds of positions are they? What are you looking for?
So a lot of it mimics what Doug is doing, but the problem with Doug's shop is, he can't represent the entirety of the state, right? He can't man a team big enough to be on every single project in every single department. So we need to have the counterparts to actually work with and liaise with ETS, right? And so while ETS might provide guidance, a framework, and some oversight, we need to have people on the ground in our departments to actually run these projects, to manage the portfolio of the projects in the department, to manage the technology. So from enterprise architecture to project management offices to our governance initiatives, whether it's related to data or whether it's related to change management, we need to have an equivalent sort of departmental workforce so that we can continue driving these things that ETS will push out in terms of best practices and guidance, so that we can carry them out at the departmental level, right? That's
tell
key.
Tell me specifically though, what are the 5 positions in terms of competencies that you're looking? So like you're saying, we need to be training our workforce. We need to be getting students in maybe high schools and college interested in positions so that we can actually staff all of our departments statewide. So what are those mirroring what Doug has? What is it that your department has that has helped you transform DHS to the degree that you have? And what are those key positions? I mean, you can't have 100 positions, but if you could have, say, 5 positions, or even the 20%, the 16 positions, what are the kinds of people you need, and what do they do?
Yeah. So over half of those positions within DHS would be technical positions that need to have understanding of modern application development, web services, cloud technologies, integration as part of an IT capability, because there's no one system that's going to take care of everything that a department will need. That's key and critical. So understanding, both infrastructure components, application level things, programming in general, leveraging, cloud-based services, because that's a whole new animal compared to what we're used to in terms of like a mainframe system or a traditional client server-based Windows or Linux system. As far as being able to continue to push and move projects fluidly throughout the department, at the program level, we're going to need project managers so that we can actually keep projects moving. We're going to need business analysts, right, that can actually work with the business units to understand what it is that the business needs to do. What is the business model? What are the business issues, right? And then, but with those business analysts, they can't be just limited to, well, I only know business, right? They have to have some sort of technical background, because they have to interface with the technical people to be able to actually translate that information that they're gathering while sitting out there in the field talking to the business units or the people, and then being able to take that back and having those same or similar conversations with the technical folks, so that we can actually bridge that and make a solution that actually works to deliver on business values, right, or business initiatives. So the business analysts, more technical than business, but that's a skill set that we lack in the state overall. And so building up that capacity for those that actually have a capability and an aptitude for understanding technology, but also having the aptitude to understand the business and business processes, right?
So of your transformed system, I guess, and you can tell me if I'm wrong, what I understood was that with the onslaught of the pandemic, your major transformation of SNAP, I guess, was completed or in process, so that you were able to unlike unemployment insurance, I guess you were further along, that you were able to address those 400,000 people in need, or be able to process. What was that process, and just really briefly, what made it work?
Sure. So one key was, we had people that could actually sit there from the business and talk to we ended up contracting that with one of our local partners, vendors. And so again, having that ability to communicate with our vendor, having that vendor sit there with us to understand what we're trying to do, we were able to achieve or build up that food and financial application system within a matter of 3.5 weeks, right? From the time that we started the discussion to the time something went live on the floor. You know, prior to that system, we took everything by paper, right? So that was in-person, in-office visits. But when the state closed down and we shut all our doors, that's what we did. We ended up, you know, that was, you know, announced in March, and in April, we started thinking about what we needed to do. So, you know, our director's office, or, you know, within DHS, we took that paper application and first transformed it into a fillable PDF document. But we really didn't have an IT system behind it. It was just another mechanism. That was the first step towards actual this digitization. And then in May, we started talking about, well, we need to put up an online system. And then in June, we went live with it, right? And now over 90% of the SNAP and TANF applications come in based on that electronic applications system that we stood up in the summer. But we were able to react quickly, and we were able to, you know, address the existing customers who want to come in through that portal. But, you know, in addition to that, all the new customers that came in, or clients that came in because they were rolling off unemployment, or they were doing it in parallel to getting unemployment. And so we just have to focus on what's that next wave that's going to come down the pipe of additional clients, and what's that additional demand. So again, it's having strong partnership with a local partner who understood our business. And that was, luckily for us, developed over a course of 20 years. You're not going to get that from an IT vendor that kind of just swoops in on an RFP, right? It's got to be a continued relationship. So we have been lucky in a sense that we have a strong local partner that we've been dealing with on a consistent basis, you know, to be able to react quickly. But we also were able to react quickly, one, by setting up, you know, the CARES Act funding for it. And then when that money became available, boom, we just quickly acted.
So that's not part of your transformation. That was just working closely with your vendor with new needs. Vendor was able to come in and work with your staff to be able to address this huge volume that came up on you.
Correct. But as I've said before, like once a system goes live, it doesn't end there, right? There's continuous enhancements, there's continuous improvements, right? That'll be continued to be built upon as new requirements come out based on what the market, or what our client base is telling us, or where we're finding shortfalls, or where we can find efficiencies or make changes to make the process better. So we're continuously improving it. So even though we did work with our vendor and they're still a primary key player in this thing, we still have our IT able and our business people able to have those communication and continue that project moving forward. So it's an ongoing modernization effort, even though it was sparked through the pandemic, or an initial response because of the pandemic. But that's how I foresee everything happening in the future, right? It's no longer, you know, save up, don't spend any money, and then, you know, in 10 years, go for this big RFP, take 5 years to deploy that, don't do anything for another 10 years, 20 years, 30 years. And, you know, it's a continuous sort of new world of IT where we have to kind of man and change the way that we actually operate from an IT perspective. So it's this paradigm shift that needs to sort of occur, both culturally, you know, in the mind, and as well as how we actually do the things that we do from an IT perspective. So that's where we're going to need this slightly different skill set and mindset from an IT perspective, because it's not a one and done thing and then you just kind of sit on it and maintain it. It's continuous improvements, continuous enhancements. It will never stop.
So what you're saying is the shift in terms of how we deal with vendors, but the other side of the coin is sometimes we're overly dependent on the consultant, and so the consultant takes over and the staff aren't trained or equipped to continue it and grow
Correct.
within the department. What is
Correct.
that? What is that balance, and what is the lessons learned there? That yes, we need to have some vendor that is localized so that, you know, you don't get an outside vendor coming in and learning on you. On the other hand, you need to be nimble enough, as you say, you know, the pandemic or any other crisis that comes, that you're able to shift and add and evolve and meet the need. What is the balance, and what is it that worked in this case on your SNAP process that
Sure.
can be something that we can look at the model going forward?
Yeah, I mentioned it earlier. So when we're mixing in new technology, right, we've got to fold it into the existing people and our processes, right? I look at it from a standpoint of when we're actually lining up some sort of IT investment, large or small, I'm also looking at it from the standpoint of I'm not just going to acquire the technology and the consulting services to stand it up. I'm going to also build in opportunities through this project, big or small, for my IT staff to participate at whatever level and pace that they can actually keep up with without putting pressure, right? They don't have to deliver it. Our vendor will deliver it. But my expectation is the IT staff will participate and they will understand the who, the what, and the why it's being built. And then with that base level of understanding, they will understand the technology that's being put on the floor. I will provide them additional supports through training, and that could be free training provided by the vendor or as part of a procured professional service as part of that contract or that work. That could be additional training that I'm getting from third parties. So for us, we've subscribed to Pluralsight, and that's an online training academy that we have a 3-year subscription for that I just enroll my people into, and then they can take training as a part of any project that they're on, and they can just kind of like a Google search within that platform, and then they would actually be able to learn whether it's Java, whether it's cloud, or things like that. So I provide opportunities through projects and supports through training, and that is not an immediate right out the gate value there, but that establishes the framework for us to continue pushing forward, right? And as our people get more and more experience, more and more confident, they start undertaking small projects on their own. So identify business problems within DHS and see if you can do something about it, right? And so some of my IT staff now are looking at technologies that we have on the floor and saying, hey, we need a travel request app. Let me try and take a stab at it using Adobe AEM, right? And then we could do a bake-off between different technologies, and then basically, we're building the capacity to think and to understand and to try to gather business requirements, not on a large scale. So it's kind of risk-free, right? This is not a production system that lives depend on, when they're choosing these smaller projects, self-directed projects. But again, it's providing opportunities to sit on real projects, big and small, and it's also to define other projects within DHS that we would benefit from. So those are the sort of 2 key things that we've learned that will help.
And do you have separate IT staff? Do you have staff from the business side? I mean, the program staff that also sit in knowing what their problems are and how they operate, for example, the outreach workers or the eligibility workers, that they are involved, or how are they involved? Or do you have separate IT staff that go and talk to them and come back and develop a system? Or how does that work?
Yeah, that's still a process that's going on and developing. So that's what I envision, So I've often said, to some of my management, when I walk around the building, when we do go back into the building, at some point I envision that I walk around the offices, I go into the office spaces, and there's nobody at their cubicles, right? And it's not because they've fired or playing hooky, but it's because they're actually sitting out with the business units, and they're actually going and living the life of a business person, right? And they're working with them, and then once they've kind of sat there and understood what the issues are and they understand how the business operates, they could then start solutioning with the business units themselves, right? And then come back and then do work, right? And then, work with their teams and then basically say, hey, we've identified XYZ problem. Let's see if we can do something. And then within that team, they would be able to say, okay, well, we need some infrastructure pieces. And if they know cloud and we have cloud subscription, they go and spin up the cloud and they just start developing something, right? Put it right back in front of the user, right? In 3-week cycles, and then say, okay, this is kind of what we thought about, and then we just do these in smaller chunks and we say, okay, this is how we're going, this is how it could be. Is this the right track? Can we build on this, right? And that's that iterative process, and that's sort of that agile sort of methodology, right? But that's a big shift from how we currently do IT today. And so it's still a work in progress. I don't have it fully in place yet, but I was able to sort of create one team out of my existing staff to actually start to work in that new model. I need to replicate that, but I also need to build capacity for maintaining the existing systems, because you can't ignore it, right? Otherwise, the existing production systems go down and they die. So you have to find that balance of being able to bring in and focus on new work, as well as supporting the existing production system. So that's also been a challenge, but that's also why I do need that 25% unlocked, so that I can start building up capacity to either free up the existing resources that are supporting the production environments, and they want to opt into working on some of the new technology, or maybe they're kind of at the later stages of their career and they're like, hey, I'm good with this, and once this system is retired, I'm retiring, right? So finding that mix of, being able to focus or bring in people that can focus on new technologies or existing production systems, or mixing both, like that's what I need. I need the workforce to be able to do that.
So you mentioned CARES Act money, you mentioned some federal monies. What kinds of, I know that DHS, many of your programs are heavily federally funded. Does the federal funds allow for or set aside, knowing that there's volume in their beneficiaries, for IT and modernization of their information that you require to serve?
Yes, there is. A lot of times there are strings attached to those federal funds, right? And so whether they're constraining it to, specifically supporting that consumer base or that client base, or whether it's CMS funding for Medicaid, right? In the past, they had what they called an A87 waiver that allowed us to make an investment through the CMS monies, those federal monies, but then it would eventually benefit the entirety of the department, so it wasn't limited to a Medicaid program.
Okay.
In addition to that, there's other restrictions. So we have to work within the confines of the federal funding. But I always look for opportunities for if as part of a project, we're building a capability. So whether it's an integration capability, whether it's a analytic or AI capability, that there is reusability of that technology or component that I can apply to different programs and then just cost allocate later to the different programs. So.
Senator De La Cruz has joined us. Senator has some questions.
Yeah, can you explain why the RFP for the child and welfare system was postponed?
So again, that was kind of moving away from that change actually started before I came on board at DHS, but I also fundamentally believe in the why of it. So it was originally going to be just a big RFP, just like any other one that we do for a state IT system. And part of the CWIS requirements for child welfare systems is modularity. And then and that fit into our strategy from a technology perspective, is because I look at things as modules. I want to build capabilities, and I don't want to focus on a particular application set that says, okay, this is the system for child welfare, right? I want to build a capability that could be reusable across the department. So if it's a contact center, and then that integration between contact center and the case management solution, right? And so those are kind of, from a modularity perspective, is what I look at from a technology investment or strategy. So that's, again, that's why we held off on the RFP, because originally it was just going to be this one big system, one big vendor, but wanted to look at opportunities to look at DHS as an entire ecosystem of capabilities and how we string them together to integrate truly, and then still provide the unique needs. So without having to limit or constrain, because we've leveraged this technology and that's what we're going to select, we can only do it this way because the system won't be able to do that, right? And we want to kind of deliver systems that will address the business need, but also be integrated from a data perspective across the department. So that's why we split, or that's why we split away from the original.
Okay, so what's the timeline, and how is this going to enhance more efficiency and effectiveness within the department?
So like I s our timeline for child welfare is we're expecting that to go live in 2024. We've developed a new strategy and approach. We've submitted that to our federal partners at the ACF. They've looked at it, and we're continuing down that path. So all we did was end up kind of delaying it for a year and a half or so.
But
2
you
years.
said, you mentioned 2024, that's like another 3 years.
Yeah. The full system will be developed, but over time, I want to develop capabilities that enhance. So let's say, for example, last year, we started to procure some of the modules for it and then starting to putting into place this year. So licensing and placements, for example. That's something that we were able to sort of deliver on ahead of the CWIS system, but it will integrate into the future CWIS system.
So
And so we're looking for opportunities for that to just bring value to business sooner rather than waiting for an entire 3 years.
Yeah, it almost seems like the perfect is the enemy of the good, because I understand that, you know, you want a system that meets your criteria, but at the same time, we need to get these systems out and running so that we can make the departments more efficient and effective. I just don't see a justification on why we're waiting so long. I don't see the overall plan as to how it's being implemented in phases so that parts of it can at least get started. So I'm quite concerned.
Parts of it have started.
Yeah, so
So
can
we
you,
can share with you, you know, separately if you want to follow up, but we can share with you our plan for CWIS.
yeah, so can you explain which parts have started and which have not, and why?
So licensing and placements have started.
Now, so how does that affect the average worker at Human Services then? Just the fact that you got the licenses?
So once that's live and we're starting to use that system, we also contract from a business perspective to multiple entities, nonprofit organizations that actually carry out the duties for that. There's no common system amongst them, right? And they're not able to log into our mainframe from remote locations. So we're trying to bring the work closer to the people who actually do the work, trying to provide a common platform for all of our partners and our internal users to actually work through. Once we have that in place, we're going to be able to recoup on our Title IV reimbursements. We'll have better data to make better decisions, to direct our, our service providers to say, hey, there's a gap in service or coverage in these particular geographies. So let's focus outreach on those areas to get more foster homes available. So we'd be able to sort of look at a whole bunch of things that we haven't been able to do.
But
and we're gonna be able to
2024
do
is so far down the line. I mean,
No, but the child welfare system is fully live in 2024. Modules of that will be coming live ahead of that.
okay,
So
so
because
can
we're
you,
taking a modular approach.
can you provide to the committee then a timeline of which modules will be ready when, working all the way back from what was accomplished and to 2024 as to what the end game is? I just think because you're moving so slow, even though it's in modules, technology is changing, programs are changing, and by the time you get to the end, the whole system's outdated already.
Yeah, we can address your concern, but that's not a concern.
Okay, well, you just need to justify it for us because I find it difficult appropriating funds for it.
All right, we'll do.
So yes, if you could submit the modules and the timeframe when they're coming online. If anything, has anything been online yet?
From the child welfare system, we're just about ready to go live with that licensing model.
Mark, excuse me, can you turn your video on? I think we're supposed to have all the speakers with video.
Oh, sorry, my camera's like closed in the laptop.
Oh, the technology guy doesn't have the.
Okay, you gotta give us a little more confidence in the fact that you guys can handle technology. So can you?
Okay, well, maybe start with your computer. Is any other questions, Senator De La Cruz? Any of DHS? Okay, so Mark, I think unless you have any more to add to this, so we understand that you are looking at different smaller systems as well. That when you send in the module, maybe you can also send in where are you on the different smaller programs as well, and what is the timeline on those?
Yes,
Thank
will
you.
do. Thank you for letting me testify today.
Okay, well, thank you. Thank you for coming by and coming by again. Appreciate it. I'm going to turn to Doug to introduce DOH and what parts of DOH we'll be hearing.
Thank you, Senator. We have Derek Vale from DOH-IT. He's been working on the Behavioral Health Administration project for a few years now. They're taking a good approach, which is they're doing one division at a time. So they did a couple of divisions already, and they're doing the next two. Sometimes the reason we break projects down is because we just don't have enough IT staff and extra business staff available to go faster than that. So Derek has used a procedure of building small and then building up from there that's been very successful. So he'll tell you the story of that project.
Thank you, Doug. Thank you, Chair, Co-Chair, Senators. So my name is Derek Vale, and I work for the Behavioral Health Administration within the DOH. And we've spent the last several years working on what we call the Inspire system to support all of the case management and other activities for our Child and Adolescent Mental Health Division, as well as our Developmental Disabilities Division. And our two divisions really, as part of the BHA, identified a need to replace our legacy systems that dated back more than 10 years in about 3 years ago, and decided to join our efforts to change how we do business and consolidate some functions. If you think about the way the healthcare operates, there are certain functions that are going to be in common. Our divisions have been in silos for a long time. And our current leadership under our Deputy Director, Eddie Mercereau, is really focused on changing the way we as BHA do business. From the perspective of a member of the public, somebody doesn't know what division they need to get services from. So our other two divisions, our substance use, alcohol and drug abuse division, and our adult mental health divisions are our other two partners. And so what we're focused on for the next couple of years is changing some of how the business works in order to implement the technology. And getting back to that point around people, process, and then technology, we believe, and I think we've been proven correct thus far, that you need to understand the business in order to apply technology, which is a tool. And so in working with MedQuest and DHS, we've been able to successfully leverage up to 3/4 federal funding for the system. And we're currently engaged now in business transformation for these other two divisions, substance use and adult mental health, so that we can end up with a collective system use. Really, I think some of the issues for us have been around change management and ensuring that we have enough staff available. As Doug was mentioning, we are very constrained on the staff side. And so some of the decisions that we've had to make have been around how do we educate the business enough so that they're ready to move forward with the technology decision. And so I think that's something that we're seeing within BHA. There's a lack of enough business analysts to go out, work with the business side, and help them understand how to apply the technical tools, how to engage in the formal discipline, and it really is a separate science around OCM, or organizational change management, that's so important for adoption of these solutions and getting to the point where we can get off of paper. Our old way of doing things for our two divisions involved a lot of paper, a lot of back and forth, a lot of somebody has to carry around a case file when they go to visit a family to provide mental health services. And those physical files have all gone away through our two divisions. And so our goals now, we have a vendor working with all four of the divisions to see what we can re-leverage. That modularity that Mark mentioned is so important. Getting to the point where we can put out an expansion of this solution so that in approximately 2 to 2.5 years' time, we can have the adult mental health division, including the state hospital, and the substance use, the alcohol and drug abuse division, all in the same solution. And from a patient, from a member of public perspective, have one front door at one system, and behind the scenes, if we need to pass somebody between us and Medicaid, or us and between child and adolescent mental health and substance use, or substance use and adult mental health, that's easy to do, and that our internal processes, we all know they take time. Some people, to Mark's point, want to retire and they just want to support the legacy tool until it's gone. We do have a significant component of that as well, but we need to be training up our staff. And I think one of the reasons that we're in support of this proposal and this bill is we know that there's a lot of best practices in this area. It's not just around the IT tool. It's around understanding where we leverage internal resources, we leverage local vendors in partnership with mainland vendors, so that we can build something on a modern application architecture, and that the technology tools are there to support our staff, and our staff want to learn, and we build something that will help the members of the public at the end of the day. And so I think the really important thing for us has been that balance of internal staff and getting through any resistance to change. So people understand that we're not here to tell them you have to use a new IT tool. We're here to identify how a tool can be identified to work with the needs of the public and work with getting the services to those in need. And so we have sort of three overall areas within DOH that I was asked to mention. We have a major vital statistics system on the other side of our administration that is going to be replaced in the next several years. And within the Disease Outbreak Control Division on the Health Resources Administration, we have a number of systems that are being modernized and are changing in response to the COVID threat currently, including around outbreaks, around case tracking and syndromic surveillance. And then within our Behavioral Health Administration, we have this Inspire system for case management that does assessment, that makes it faster and easier to get somebody in the front door, identify members of the public where they have overlapping services, and we will be able to, this year, for the first time ever, identify a patient, a member of the public that is has appeared in multiple divisions for multiple services at the same time. And that's something that our leadership is very much wanting to happen, and is part of why we as a administration are going to be reorganizing to help better serve the public. On the technical side, some of the commonalities around the systems, around project management, organizational change, engaging the business, having IT design using modern tools. This is primary system we're talking about here for behavioral health is on CRM, or customer relationship management software, and that's something that other programs are leveraging. Something you see more and more in industry, being able to identify where a common platform can be reused, and based on the needs of the businesses, smaller changes can be made. And to the point that one of the senators was making, that you can be agile from the technical development perspective, get some benefit out of the system, and then add to it over time. So when I mentioned that we went live with our system for the 2 divisions 2 years ago, we were able to get that off the ground, get most of the functionality, and then we've added more functionality over the course of the last 2 years. So on the technical side, we've had teams, we have some more junior level people that have been having opportunities for training. And in the background, we have to train our business users to better understand the data. One of the big gets for us on the clinical side is to be able to identify patients and their needs and look for trends to better use state dollars, federal dollars, and to make clinical data-driven decisions. If the information is on paper for somebody's mental health assessment versus it's in a system, and you can trend out and say, based on these factors, based on these clinical diagnoses, this is how we can better help them, how we can better get them through services, and have a lower dollar cost and better outcomes for those families. We think we're doing the right thing. I'm happy to stop there or take any questions.
Senators, Senate, you have a question? So thank you for joining us. I just wondered, where are you in your in your process of transforming? You started 2 years ago, and where are you now in terms of moving forward and having an integrated system that
Sure.
can serve not only internally but externally?
So with this system, we are now providing almost all the functions for child and adolescent mental health and developmental disabilities. There's really add-ons. We've completed all of our initial scope that was completed within the last 2 years. The project for these two divisions started about 3 years ago and will formally wrap at the end of this calendar year. We are simultaneously proceeding now in the business process change for adult mental health, the state hospital, and alcohol and drug abuse division, ADAD. We anticipate then that the systems development for HSH and ADAD and AMD will proceed from this fall until approximately 1.5 to 2 years time.
So what is in the system? So, for example, I know BHA has the wholeness caseload. Is all of that information in there of who they are, where you can place them, or
Sure.
is that, or are you doing more internal data retrieval, or is there some connection with the public and public agencies?
So there's both. There's both internal data in here, and the majority of it, which is for BHA, which is related to customers. That's how we identify them in the system. It's basic demographics. It's who somebody is, what their needs are, the clinical or medical assessments they've had. It's if they have diagnoses and degrees of impairment from a mental health or intellectual or developmental disabilities perspective. It's what case plans they have. Just as if anyone has a chronic condition, you go to the doctor and they come up with a plan of care for you over a span of 6 months or a year or 2 years, and that gets regularly updated. This is all in the system for the first time. It is not on paper. It is accessible by all of our contracted providers. BHA does not work alone. We work with community providers, contracted entities that do a lot of the direct services. They are a partner, and the only way we can do these services is working with these community partners that provide treatment in people's homes with their families and in the community. It includes notes on care from them. It includes billing functions back to Medicaid for federal and other insurance reimbursement. It includes our quality assurance. It includes other case management activities and case planning for service authorizations with these providers. And it includes a provider portal. And so the clinical providers can then enter all their information into this, not on paper anymore. That's for the last 2 years. And then allows us, to the last point, internal reporting. And some reporting out that we can show as dashboards to our providers so they know how they're doing, because we are in partnership to help these members of the public.
So what you had mentioned earlier, is this part of this system where you would know how many times I used a service, even different services within the system, within Department of Health, or elsewhere with DHS, I guess, where you partner. Is that something that your system is capable of doing, or is it up and running now, or is it something in the future?
Across 2 of the divisions, it is operating now. And that collaboration with Medicaid relative to use of services, yes, that's in place. We're billing to Medicaid electronically, and we have comprehensive reporting within the BHA. What we're engaged in over the next couple of years is to bring on the other 2 divisions that are still using their systems that were not part of this scope originally. And we've made the decision in working across our administration and with ETS and with MedQuest to bring our adult mental health division and the state hospital and alcohol and drug abuse all into the same system, so that we'll have all of the data. We do have some combined reporting from these other divisions now, but it is limited. And the goal is for us to be able to say that if this person had a need for mental health services and substance abuse services, which often co-occur from a clinical perspective, we can best help them, and we'll have one front door for a member of the public to get in and ensure that we're best helping.
So, so how much, or how extensive are the federal funds to support this? Because you're serving their clients, basically, Medicaid, Medicare, as well as some of the other federal programs.
So the development of this system has been funded at approximately 3/4 or 75% to 80% federal funds. That's based on a 90% federal reimbursement rate, but then allocating for populations that are not within Medicaid that we serve.
So,
And so, yeah, this is to serve 100% of the behavioral health administration customers.
so ongoing maintenance can also be funded.
It can also be funded at a slightly lower rate at what's considered the federal 75-25 match rate, but again, cost allocated for non-Medicaid populations is slightly less.
And what kind of staffing do you have? You were on when Mark said that you know, he's got these various positions that are necessary to mirror what ETS does. How do you function so that you would have your business partners as well as your IT staff? What does that look like in terms of being nimble and getting the work or the transformed procedures and IT support?
Yes, it's a little bit of a difficult balance. We're, I think, always short on technical staff, and to a certain extent, we have to select good vendors to work with us to balance where we do not have or will never expect to have certain high-level technical resources. But in terms of understanding the business, we take that as something that we must do. And so some of the team that I work with is business, and some of it is technical. And they both need to understand how the processes work so that the system can be designed to best meet the needs of the divisions and the public. We're short several positions currently, and then there are others where, quite frankly, it's very difficult to hire within the state due to restrictions and competitiveness of the private sector. And so some of it is a balance and working with our partners. Right now, we're partnered with one mainland company and with Data House on this project. And we found it to be beneficial to have people who understand local and people who also have a deeper technical understanding of some of these larger platforms.
So what are those critical staff? I mean, do you have a complement now, or are you missing staff? I mean, what so that you can
we do have
proceed?
some now. We have some technical positions that work for HISO, or Health Information Systems Office within DOH, which is where I formally sit. But most of us, our team, are also tied to some of the divisions. And so what we're really short on is technical resources as well as business analysts to really help understand some of the big business challenges. But as Mark said, also have a training in the technology pieces so that we can do these things and we can accomplish what otherwise some of the work has to be outsourced because we do not have the staff to do this building. And the danger there is that then consultants understand it more than the staff do. And that is not the way we intend to operate. And it has definitely slowed our progression to ensure that we understand the business, we understand what the division needs to best serve the public, versus having a consultant come in and say, well, use this component, use this module, because we had it work somewhere else and it may not be what works best here. But the intent for us is to re-leverage the modules we have built that have worked well, say for CAMD and DD, and then use them for the adult mental health population, where a lot of the processes are very similar.
So I guess it's that balancing, and I don't know if you have any further lessons learned from what Mark mentioned, but this not being overly dependent on the consultants, but having enough expertise so that you're constantly evolving and working with your own in-house staff so that you're not totally dependent on outside consultants. And what is
Yes,
that
and it
balance?
is,
What-
it's
what
a
determines
careful balance to ensure that we have all the voice of the business, and on the clinical side, on the administrative side, that we have enough people who understand what needs to be done so that we can form the technical requirements and develop the system or modernize the system, or leverage new modules to the system over time. As Mark was mentioning, we start with an assessment, but we may not have all of the other pieces. But that can help the business because we're removing some paper forms and to proceed down that in an orderly plan. And we found that to be a pretty beneficial method of doing it for us within VHA.
So do you have any resistance from your business partners, or do they see the benefit of the technological tools you're providing them so that that you can get the support as you're moving ahead? I guess that's going to make the process faster as well. If you're looking
Yes,
at
it does.
business.
And this it's a formal science, this organizational change management, and something that I would love to see, and our department would love to see more resources to refer back to, and have best practices from ETS, because this is something that in other organizations, in other states, in business, people are trained on, and there's not currently training opportunities available here or common best practices to refer to. And so we go back to industry contacts, we go back to our knowledge for training around this, but there are some best practices for organizational change management. And that can be one of the biggest predictors of success or failure of large IT projects. I'll defer to Doug. I'm sure he and maybe Layla have more to say around that. But it's something we've seen is if you are reaching out enough to the business and helping them understand what their business problems are, you can best solve the technical problem. And that just having those conversations and showing that you're more Akamai will allow the solution to be more accepted, able to train up more and have less resistance.
As we look at that Senate Bill 1307, which is to have a modernization program office in ETS to work alongside with the departments, it is starting out small because of our budgetary constraints. But the idea is to look at what can work and what can work with their working alongside and having your staff and your administration in full support to provide the necessary resources on the front end as you go forward until completion and you know, when you're off and running on your own. So in terms of your experience to date, what do you see as major processes or support that you see ETS needs to supply to you to help you along that route faster and to get to having your systems, at least major parts of your system in place?
I think from our perspective, it's a question around ounce of prevention or pound of cure. Having the resources to focus on these sort of non-typical technical areas, as well as additional technical resources to work with the large vendors. The overall landscape for some of these major systems has contracted into some really big companies, understanding how to deal with them, having some common references in dealing with the Microsofts and Salesforces and Googles of the world, and the terms for platform licensing. That it's a lot more of the industry's moved to an Oracle and Salesforce, these large IT platforms, and the best practices in dealing with them is one piece of it. The other piece is organizational change management, which is a discipline, and other is project management. I think those are some of the big areas, and then just training opportunities for our teams, where we, as Mark was saying, go out and have each department go find what are the best IT training tools potentially for each department, but then we're not all on the same page, and common resources to train IT staff across multiple executive departments would probably help us spread best practices. for things like building requirements around systems and engaging the business so that the business knows what they're going to get and getting through some of the acceptance barriers to then build out a solution and have it used and successful.
So I know that you've got a huge department. I know that the director said you have 2,200 employees. And so I know it's very expensive, and you also have different categorical grants that come in, and that, what Eddie's doing with the BHA is great to have you now look across silos and be able to even pull your resources. Is that being done with the department as a whole, so that your IT becomes kind of a sort of organizing structure so that funds that come in from the different divisions or different programs can be put into a pool and can support the staffing and support services that you would provide? Is that being done?
I would defer to others because I don't have all of the background on where that is going to be going. I will say that those are conversations that are underway. It is something that I would consider to be important to ensure that the multiple different programs, some of which have more funding and some less, can best support the overall technical needs of the department. I will say, because it is my formal area of operations within the Behavioral Health Administration, we are already engaging in those kinds of planning conversations, expecting where things are going to be. And this is a dialogue that, quite frankly, we started among our two divisions more than 3 years ago. And so it is something we would expect to accelerate, at least within the Behavioral Health Administration.
Okay, thank you, Senator. Any questions? Well, thank you very much, Derek. Appreciate
Thank
that.
you. Thank you for this opportunity. I think the one area that I did not share, but just I would want to keep on the list for central resources with ETS is related to data governance and the use of data and data analytics. That is something that is increasingly important when platforms like this are put in place and our lives are being increasingly driven by data, both inside our workplaces and at home. And we're carrying around iPhones with gigabytes of data on them. Understanding how to use that information and share it across programs is also something that is increasingly important for best practice. Thank you.
Thank you. Thank you. Doug, are you still there? Want to join us? Oh, hi. So
Yes, I'm still on.
Okay. Yeah. So here, thank you for sharing and the different departments and their stages of transformation. I do want to go back and circle back to what ETS is doing and what you're looking at in terms of supporting these big programs, big projects, in a way that your staffing can be, I guess, transformed as well in terms of what we've heard from DOH, DHS, DOT, DOTAX, and how do you envision this? I know we're starting small, and that thank you. We're able to use some of the special funds, hopefully, to support this. But I'd like to see it expand with lessons learned. So, in terms of what you've heard and what you've experienced, can you give us kind of a sort of pathway of how you see this moving?
Yes, Senator, I can say that, you know, we know we can't afford to be spectators while the contractors are spending money. We need to be very proactive and active in working with them as partners to make sure that the money is well spent and that the business is well served. So we will say that we want to make sure all our systems are well designed and suitable for their intended use, you know, within the departments. We have one really good model project management office that we have been using for the ERP system. You know, we started out and did the human resources part and then payroll and time and leave, and now we're getting ready to launch the new financial management system. We're just doing procurement on that now. So we've learned some good lessons that we need to break these big major systems down into smaller parts so that we can manage them with the people and resources that we have. And I think the key is just to you know, that one team is very dedicated to the ERP. We really would benefit from having that second team that could do the same kinds of things for all the other, you know, business-oriented systems that the state runs, providing that expertise on best practices and things that each department can't have specialists in. You know, we want to have those in ETS.
So are there competencies in business operations, in technical operations, transferable across subject matter, so that you've got certain people you're looking for to staff this, I call them the A-team, to staff them so that they can bring that kind of expertise that we're hearing, for example, Derek saying, in terms of having data governance, organizational change, project management, capabilities to help the departments really at the front end become much more focused on what has to be done within the department.
Right. There are some commonalities, and one of them is that a lot of the major systems that the departments have tend to be case management type systems. So they're used to manage casework on, you know, beneficiaries. So we need some of that expertise. The departments have some of that expertise already. But there are certain things that are sort of universal to any IT project, you know, to be the project manager, to look at the architecture, to be involved in the testing and training and the organizational change management, the data analytics and business intelligence. Security, of course, has become very, very important. And quality assurance and procurement. And then depending on the project, we have business analysts or technical analysts or both. So there are defined roles that sit in a program management office, like we have for the ERP. And we would try and duplicate that over time with this second office so that, you know, they would sit on the meetings that the departments have with the contractors. They would help develop, you know, the RFPs. They would help make sure the quality is where it should be and that the systems are on target.
You know, I know you require the departments with these big projects to have IVV set-asides, I don't know what you call it, set-asides, but they have to pay for that independent review on verification. Would that be a possibility, especially since it's an 80-20 kind of payment by the feds, for the departments, if they're all seeing the benefit of services that you provide, to be able to set aside X percent as paying or getting staffing or support so that we can really get expert staff alongside of their department as they develop their projects, especially the big projects. Is that, or has that been done, or you know, has that been discussed at all?
We can do that for some things, but we have to be able to account for the amount of time the person spends on a particular project in order for them to track back to get funding, and that can be very difficult. So there are some staff people at ETS that get tracked to a particular project, and some equipment at ETS that gets tracked to a particular project. An IV&V can be paid for that way, you know, using some federal funds to support the project. But it would be a little difficult if we're managing a lot of projects or support, and normally we're supporting at any given time 10 or 15 projects, so it'd be a little difficult to track. But we could sure look into that.
Yeah, I think, you know, as we look at that, if we have this program modernization office, it should be to provide that kind of support, but also be a model so that you're assessing what works, what doesn't work, where can we pay for these costs so that it's not a one-shot deal, that it really is, I think as Mark said, you know, everything is iterative, and so you're going to constantly evolve with technology, and how do you know that you have put in the best staff you have to support them, but they have the staff and the training, so they can continue it for the long haul and constantly evolve and not be at the behest of the consultant doing all the work and you know, not really knowing your business operations. So that it seems that if this project can also be assessing what works, what doesn't, how do we pay for it, and how do we continue the transformation into the future. I think we have so many archaic systems, not only in technology, but in the way we do business. And so we really need to streamline many, many systems. And I see what we're doing with IT, having to understand business operations, not garbage in, garbage out, but really what information do we need to serve the public better? And those questions come, I think, from your program modernization office, asking those questions in the front end, because when departments are so close to it, they don't see the question. It's just, we've been doing this forever, so, you know, the question never comes up, is this helping me do my job better? So
Yep, that's exactly right. It's how we've always done it tends to be said a lot. But then we have to say, well, is that how the best practice is in this industry or in this area?
Yeah, and I think that, you know, and I've heard you, and you say, you know, it's not your job to be telling them what to do. They really come as a partner, and you know, you're just helping them form the tools. But I think one of the benefits that I hear from what you're saying that you've done to help these programs is to ask the question. To ask the question of, you know, what is your mission? What are you supposed to do? Who are you serving? And what, you know, what information do you need to serve them? Just to ask that at the front end gets the department or the programs to think about what have I or am I doing? And I think that's a really important value that you can bring on the front end.
You're right, and we ask why a lot. Why are we doing that?
Yeah, no, that's
What's the benefit?
Yeah. Senator, do you have any questions of Doug? Do you have any more to tell us, Doug, about how you want to proceed? I think this is a good program, and it'd be nice to hear your thoughts.
No, I mean, unless we know what we're gonna do as far as a bill, appropriation, some type of action item, then we're just going in circles congratulating each other. I think we really need some kind of like follow-up.
Right.
So I'm not sure what your agenda is and how you, what timetable, what action,
I think,
what you need, and then we should make it clear to them so that they follow up.
Okay, I think it's, so Senate Bill 1307 has passed, the Senate. It's now going over to the House, so it would really be very helpful for you to make sure that the House also supports your efforts and what this is and what this program is and how it's helped the departments in terms of really transforming quicker and really providing services to the public that needs to be done. So I think right now our job on this side is completed. We had, with your help, are going to use special funds and work with the comptroller to ensure that the funds are there for starting the office off.
Okay, that's good, and we will certainly report on this in our annual report, and we can talk about, as we have done, all the system engagements that we have that we're working on.
Okay, so good. So if you can, then we will do what we can to also support and talk to the House, but it would help for all the departments as well as you and any of the providers who see the benefit of programs like this to date. Would be very helpful to get it passed in the House as well.
Thank you for your support of our systems and IT, and we'll work with the House to get this passed.
Okay, there being no other business, we'll adjourn this briefing. Thank you.